I'm Emily, and I was a caregiver to my grandfather, George Eitzen, and we are from the Waterloo region in Ontario. And my grandfather, he worked in a factory, a few jobs over his life, also worked on farms a lot. He liked to have fun, honestly, simply put. Even as he got older, he still kept doing everything. Like, age was never a barrier for him. So he had 4 children, 3 sons and 1 daughter, and 8 grandkids. And then actually this September, he became a great grandfather for the first time. So that was a very exciting moment for our family. He grew up during the Second World War, so it was very difficult in Europe. Spent some time as a prisoner of war, like in a labor camp. So, we'd ask him, like, how did you get through that? And he just said, yeah, his faith, like he just didn't want to give up. So lots of challenges, right? But I think that's something that remained important for him his whole life. And then definitely family as well, I would say. For me as a caregiver, like my connection with him helped a lot. Like I saw it as time that I got to spend with him. So even though it was definitely rough at times, we still had fun. Like it was really an enjoyable experience as well, just to be with him. When he was diagnosed, it was still pretty mild, I guess. Like at the time, it caught it pretty early. So I never really realized the scope of it, or I guess like how bad COPD could become over the years. It was a long process to kind of figure out with his healthcare team, what medications will help improve his symptoms. Yes, many times over the years, he did have to be hospitalized for sure. I'd say probably 10 years into the diagnosis or so. He was just more prone to like sinus and chest type infections, I think, as well. So usually it would be because of that. I think one year all of us kind of had, I don't know if it was like laryngitis or bronchitis or something like that. And unfortunately, he ended up getting it and had to be hospitalized. Another time with pneumonia. So it wasn't usually like COPD, but just kind of like he caught a cold and we need to just watch over him and make sure. It just kind of felt like the right thing to do. Like I wanted to use the experience for good and like connect with other people who had gone through something similar. And I came across the Lung Health Foundation and I felt like it was kind of perfect. I thought their values were really in line with mine. I thought they were doing really great things and the advocacy efforts. Just thinking of my grandpa's experiences, not to let it define you. Of course, it's difficult and people can be diagnosed at different stages, but he really was still able to live his life. If you get diagnosed early enough and get a good healthcare plan in place, you really can still maintain your quality of life and see family and do the things that you used to. You can still live your life for sure and still have a long life. My grandpa lived until he was almost 93, so that was pretty good.